So what is Centchroman? Centchroman, also known as ormeloxifene, it is a non-steroidal selective estrogen receptor modulator drug which is developed by CDRI in India, and it comes under the brand name Saheli and mainly used as non-hormonal oral contraceptive, and it can also be used in the treatment of various gynecological conditions also. So what is the mechanism of action? It is selective estrogen receptor modulator, so it is anti-estrogenic on uterus and breast, while it is mild estrogenic action on bones and other tissues. So unlike OCPs, it does not significantly suppress ovulation, and hence hormonal side effects are very less. So what it does, it delays the ovum transport, prevents implantation by altering the endometrial receptivity because it is anti-estrogenic on uterus as well as the ovaries. So there is no ovulation, there is no implantation, and also it causes asynchronous development between the embryo and the endometrium, and also it has anti-estrogenic effects on the uterine tissue. Ovulation usually continues normally in most of the female, but it delays the ovum transport. So the route is oral, and the half-life is approximately 5 to 7 days, and hence weekly dosing is recommended. Now coming to indications of Centchroman or Saheli, contraception is the most common indication in which we use it as a weekly oral contraceptive pills. It is advised in females who cannot tolerate estrogen containing pills, like history of thrombosis is there, lactating mothers, and women with poor compliance to daily pills, so that they can take weekly pills, and women at risk of thromboembolic diseases. So the first indication is contraception. The second indication is DUB or AUB. DUB is dysfunctional uterine bleeding or abnormal uterine bleeding, and it is effective in menorrhagia, heavy menstrual bleeding, and ovulatory dysfunctional uterine bleeding. It reduces endometrial proliferation because of anti-estrogenic action over the endometrium, and hence reduces the menstrual blood loss. Because it has anti-estrogenic effect on breast tissue also, so it can be used in conditions like breast pain, also known as mastalgia, and fibroadenosis of the breast. It can be given. So occasionally we can also use it in endometriosis, and it may help to reduce the dysmenorrhea and the pelvic pain. So how will we are going to start this drug in the initial phase and the maintenance phase? So for contraceptive use, the initial phase contains a 30 milligram tablet that is taken twice weekly for first 12 weeks. So first शुरुआत के 3 महीने में हमें मरीज़ को बोलना है कि उसको हफ्ते में ये ड्रग 2 बार लेनी है. फॉर एग्जाम्पल, इफ द पेशेंट इज हैज़ टेकन द ड्रग ऑन संडे, then she has to repeat the dose on Wednesday as well, and this has to be repeated for 12 weeks or the 3 months. Now in maintenance phase, after 12 weeks, only once weekly dose of 30 milligrams on fixed day is recommended. Now what will we do if the pill is missed, if there is missed pill for less than 24 hours? Then as soon as she remembers, she has to take the pill immediately, and if the duration is more than 1 day, then take the pill and use backup method of contraception for 7 days. For abnormal uterine bleeding or dysfunctional uterine bleeding, the dose is more, that is 60 milligram twice weekly for first 3 months, and then 30 milligram on alternate depending on the protocol. For mastalgia, 30 milligram dose on alternate days or twice weekly for 3 to 6 months is recommended. Now what are the advantages of Centchroman or ormeloxifene or Saheli? This is a non-hormonal contraceptive, and it has no effect on estrogen and progesterone. Weekly regime is usually recommended, and it improves the compliance as compared to the daily oral pills. The side effects are minimal. There is no effect on blood pressure, lipid profile, carbohydrate metabolism, etc. As seen with oral contraceptive pills. It can be safely given during lactation, and there is low risk of thromboembolism, so it is safer in females with risk factor for venous thromboembolism, and ovulation is usually preserved in these females. OCPs are associated with weight gain, but there is no weight gain in Centchroman or Saheli. Now coming to the side effects of Centchroman, the most common side effects are mild and reversible, and it includes the menstrual irregularities like delayed cycles, prolonged cycles, amenorrhea or amenorrhea. There can be headache, nausea, dizziness, abdominal discomfort, or spotting or scanty bleeding, while the rare side effects includes ovarian enlargement, functional ovarian cyst, acne, and mood changes. Coming to contraindications, the absolute or the relative contraindications. So in pregnancy, this is contraindicated. in PCOS with irregular cycle, because PCOS already have cyst in the ovaries, and if this drug is given, it can aggravate the cyst in the polycystic ovarian disease, chronic cervical hyperplasia, severe liver disease, and hypersensitivity to the drug. Failure rate is approximately 1 to 2 pregnancies per 100 women years with correct use, and the effectiveness depends on the strict adherence to the weekly schedule.